Ready?
Okay, you have the question sheets, all of you have the latest question sheets which I shared, right?
Yeah.
Right. So once you complete those questions, I think we've got 23 questions specific and 6 general questions.
Yeah.
Yeah. So once you finish that, of course, you'll be doing the round of introduction. You can also mention about Dr. Raghavan not being able to make it today due to emergency. And once you complete that, then you hand it over for me for the YouTube questions.
Yeah.
I complete it with the vote of thanks.
Yeah. And you will complete with the word of thanks, right?
Yeah, I'll complete it with the vote of thanks.
Okay, great.
So there are 22 questions.
22. Yeah, I think one of those questions I removed it, the one you mentioned, Dr. Irfan.
Yeah.
Yeah, so we've got 22 now.
22 questions.
Yeah, 22, right? Boss, one thing. Do you want me to tell the names of the people who are asking the questions? I think we can omit it here.
The questions asked by people?
Yeah.
No, I believe they wanted their names to be mentioned. So let's keep it that.
Who wanted?
The people who given the questions.
The questions are asked for the general benefit here, not for anybody's name to be announced on. Anyway, okay, fine.
Okay, we've got 2 minutes, we go live. Let's go live.
So are we live? Waiting for Uday's confirmation.
Yes, sir, we are ready. Ramesh, sir,
Yeah.
let's go live.
Yes. So very good evening and warm greetings once again from Prince Highlands Flat Owners Welfare Association to all our experts in today's panel and YouTube viewers also for this discussion on living with COVID-19. I, Ramesh, would be the host and moderator of today's show. This is the second and last episode of the two-part series, Living with COVID-19. Question about do's and don'ts and various other doubts that arise in the minds of the common people need to be clarified by experts. It is a pleasure to have amongst us in our panel today some very experienced and eminent persons in the medical field who will give their professional views and advice on various aspects of the ongoing coronavirus COVID-19 disease outbreak. We have the same expert doctors who were there last.
Please send it to Manikandan.
Brief introduction of our panel doctors in alphabetical order. Dr. Deepak Kumar Bhairate, a senior consultant with Miyot International Hospital. Dr. Punya Ayyappan, consultant surgeon from Sri Ramachandra Medical Center. Dr. Vaishnavi, consultant ophthalmology from Ramachandra Medical Center. From out of the previous panel, we do not have Dr. Raghavan with us today, as he has been gone on urgent duty and he is not able to take part. However, we thank him for the previous sessions, very useful information that he had been able to give us. So many questions have been raised by our residents and some by our online viewers on YouTube. And I think it's time now to go straight into the Q&A session. Sit back and hear what the experts have to say. So we will start with the questions. I will be addressing the questions to specific doctors. I hope that is okay with you.
Yeah.
See, there are some general questions, a few of them. I'll go with the general questions first. Virus strains are stored in lab. Is it possible to manipulate the strains and develop a new one in a lab? This is a question raised for Dr. Deepak to answer.
Yes, it is very much possible to manipulate. It is possible to manipulate the virus to bring in a new strain. After all, virus is a chemical material. So it's small chemical reactions and small manipulations in high-tech virological laboratories are required to bring in the changes in the strain. So it's possible to bring in the change.
Yeah, okay, thank you.
Sometimes it can be for a beneficial purpose. Sometimes it can be for a harmful purpose. The beneficial purpose will be to manufacture live attenuated vaccines. So the harmful purpose can be to bring in biological warfare.
Okay, thank you, doctor. The next question also to you, Dr. Deepak. What is mutation of virus? Are different vaccines required for each mutation?
Mutation is change in the genetic composition of a virus. So if the mutation is drastic, then you need a different vaccine altogether. But if the mutation is minimal, then the same vaccine may be effective.
Okay. The next question from Mr. Prakash Krishnagiri to Dr. Vaishnavi. What should people do to get over the fear of getting affected by COVID-19?
There is absolutely nothing to be worried thinking about COVID. It's just like a common flu if we are following all the necessary precautions. I would say too much of any information is definitely not good. So get yourself updated with the recent news, but don't go too much into it. Spend your routine day with a proper activity or a routine activity with good mental health, good diet habits, and proper sleep would be enough. This will put your mind.
Yeah, I agree with you, Dr. Vaishnavi, because there seems to be too much of a paranoia and people are going around with a lot of fear. And you know what happens due to this is that they start treating other people in a totally different way than what they were doing earlier.
Nothing to worry at all at the moment. If you are following the necessary precautions of hand washing, mask, and social distancing, I'm sure it's just another common cold.
Okay. The next question again from Mr. Prakash to Dr. Ayyappan. There is a stigma developed in the society with regards to COVID-19 patients. It is so bad that even when one sneezes due to some dust, people immediately start treating him like an untouchable for a few days. As a society, how can we remove the stigma?
Yeah, actually, if you see, normally patients develop cold or running nose or something like that, like a mild sneeze or something. It's definitely, you should not take that as a COVID immediately. But that should be in the back of the mind. Mainly when patient develops fever or patient develops any breathlessness, that is when a COVID should be suspected. Those are the patients who has to be tested. These are symptomatic patients. And as we discussed in the last session, there are someone called asymptomatic carriers, which we cannot distinguish. So a person just sneezing for a dust or allergic to dust is nothing to be worried. But I would suggest ask them to wear a mask and ask them to wash their hands, use a tissue paper instead of using a cloth or something like that.
Yeah, previously when a person sneezed, they used to tell God bless.
Yeah.
And now I think it's just totally different. And the next question is from Mr. Prakash to Dr. Ayyappan again. How far were these lockdowns successful?
See, actually, lockdown has helped us a lot. The thing is, it has decreased the flow of transmission. So initially, if you would have had the same number of patients running around with this kind of COVID, the number of cases which would have come across by now would have crossed US census. Due to this lockdown phase, we are now taking a slow curve upwards. But the thing is, with proper tracing and maintaining social distance or something like that, we'll be able to bring this curve downwards at an earlier phase.
Okay.
One more thing here I would like to add is it has given the adequate time to the government to bring in the necessary changes to step up the beds available and then buy the PPE kits, and to make other changes in the infrastructure as necessary.
Ventilators, everything has also been increased as of now after this lockdown period. And one more thing is, people have learned to use social distancing, mask, and everything as they started developing, getting informations that it can spread through these kind of modes.
Okay, okay. Thank you so much for your inputs. Another general question is to Dr. Deepak. Are we going to live in future with COVID-19, just like the common cold and flu, for which no vaccine has been found till date?
We are going to live with the virus, no doubt in that. But the only thing is, we are hoping for the vaccine very soon. Virus is going to be there, but the immunity is going to be through the vaccine.
Okay. So you are confident that the vaccine will be developed for this particular strain of virus?
Yeah, yes. Given that the velocity of mutation, that is the speed with which the mutation is going on, which is quite slow.
Okay.
We are hoping for the vaccine to come up in the near future. Particularly AstraZeneca is coming up, so hope for it.
Okay, thank you, doctor. And so now let's move on to the specific questions in today's episode. First question from Mrs. Sujata to Dr. Deepak. Schools and colleges are set to be open soon. What advice can you give to students who are to get back to college, and specifically to those who are going to stay in hostels? And what would be any special precautions to be taken by hostel students?
Yeah, it is like a long question, but still I'll try to answer it. First of all, we have to encourage online learning with regard to school as far as possible. We should limit the hours of school, and the timing of the school also has to be scheduled by the authorities in such a fashion that there should not be crowding at the school place. Maybe there should be a different timing for primary school and different timing for higher primary and different timing for secondary schools. And so that the number of people at the given point of time in the school is limited. And it needs education of teachers, non-teaching faculty, students. And once a student enters the campus, they have to enter compulsorily with the mask. They need to be sanitized at the gate, and thermal screening has to be done at the gate. And required changes in the infrastructure has to be brought in the school so that there is less number of students in the classrooms, and classrooms should be well ventilated, and it should have adequate lighting as well. One more thing, restrooms need to be cleaned and sanitized, disinfected every 2 hours, and all the surfaces which are touched repeatedly has to be sanitized. And with regard to hostels, hostel has to be restructured, needs to be restructured. One person per room is ideal. But if such a condition cannot be attained, in such a scenario, maximum of 2 persons per room is adequate. And wearing mask inside the hostel premises is not feasible, because when you're wearing the mask on a constant basis, even when you're staying indoors inside your hostel premises, your oxygen intake is going to be low. Current day mask wearing is advocated only when you're in a crowded place or when you cannot maintain the social distance. So if you're wearing the mask throughout, then your total oxygen supply to your body is reduced. So wearing mask indoors is not feasible. And the other thing is, they should desist from sharing the utensils and sharing the linen. These things can be done. And also buying the commodities in the hostel has to be through the pre-approved vendor who follows all the sanitation procedures. The most likely place where danger is imminent is restrooms. The other one is dining hall. The dining hall, proper social distancing has to be maintained, and we should avoid crowd. It is even better to avoid going to dining place, or you can just collect your food from the dining room and have it in your room. That is the best thing. And always carry sanitizer with you so that you can sanitize the tap in the restrooms and sanitize the commode seats, particularly the Western commode. So these things needs to be properly followed. A highly disciplined approach is required, especially in the hostels.
Yeah, thank you, doctor. Thank you. I think that is quite educative. The next question to Dr. Deepak again is from two people, Harshit Giri and Prakash. Is it safe to order home delivered foods now, as most of the hotels are now not only open for takeaways, but shortly the in-room dining is also set to partially open?
Yeah, it is safe to order food online. How we should use is it should be through the contactless delivery. So contactless delivery has to be encouraged. And once you receive the food, we have to discard all the paper covers and carton box and reheat the food before we consume.
Okay.
And in-room dining, we should be careful about it, because again, there should not be a crowd. And with the problem that the ACs, they are switching off, but there is no adequate ventilation. Once we switch off the ACs, we should make adequate provisions for ventilation, which is still not there.
Okay. Thank you, doctor. This question is from Tangamani to Dr. Vaishnavi. Is it safe to use currencies, notes, and coins for marketing? Will the infection spread through the currency or coins?
Yes, definitely it can spread through currencies or coins. So it's better to use digital transactions at this point in time. Because droplets from any part of the body, it can even be saliva, it can be even aerosol from the nose or eyes, can easily be in the vendor's hand. When they are going to give the currency, it's possible that you touch that and you get exposed to the infection, whatever is possible. So it's highly advisable to follow digital transactions at the moment.
Okay. And the next question also to you, Dr. Vaishnavi, from Satya Murugavel. If you receive any guests at home, what precautions should we take?
Guests at the home right now, it's definitely not advisable. If it's the worst come worst scenario, they are coming inside the house, avoid taking them to all the places in the room. Confine their interaction only to the hall or to the the balcony area, wherever you're receiving them. And next thing would be maintain social distancing and handle the utensils. If you're going to give them any food or any drink, make sure you sanitize them properly with proper precautions after they leave. That is very, very important, especially the hand knobs and place wherever they are touching has to be sanitized properly with caution, and avoid kids getting exposed to them or adults who are sick.
Okay, thank you. Next question from again Satya Murugavel to Dr. Ayyappan. Is it safe for children to go out and play? What precautions should be taken?
Children are more prone for developing COVID-19. If you see the recent number of cases that are being infected, the kids are also getting more infected. So we would suggest is to avoid children playing in group. If they are going to play individually, fine. But if they are going to go and play in group, hug each other or something like that, that is not advisable. And always teach them. Kids should be educated to maintain a social distancing even when they are playing outside, at least till the vaccine is ready.
But getting the kids to wear masks and making them to keep it on is going to be a tough job, I guess.
Yes, but the thing is, if they are going to wear a mask and they are going to run around, as Deepak sir said earlier, the oxygen supply to the body is going to be less, which is also harmful. So they should be advised to keep their mask. But if they are going to interact with someone, definitely they should wear that mask. But if they are going to just play around solitarily, not in a group or something like that, then that should not be a worry or anything. Like cycling, that should not be a worry.
Okay, thank you, doctor. Next is from Mrs. Jayalakshmi to Dr. Deepak. Any special instructions, do's and don'ts for senior citizens for walking or their workouts? Is use of masks necessary while we walk or jog?
Okay. Where we are walking is of importance. If you are walking in a crowded place, there are too many people moving around us. Definitely, we have to wear mask. And in such a scenario, we have to avoid strenuous exercise, like avoid running or jogging. Walking leisurely is quite adequate. If we have to jog, then find out the time where there are less number of people And in that time, it is better not to wear mask. If you are doing strenuous exercise at that time, it is better to avoid mask.
Okay. The next question to Dr. Deepak is from three people, Mr. Adi Raman, Mr. Dinesh Gupta, and Mrs. Pramila Rao. How should diabetics take care of themselves under the current circumstances? Are they more prone to getting infected when compared to non-diabetic people? What are the precautions we have to take while we are going for walking during regular medication?
Yes, definitely diabetics are more prone to develop COVID-19 because they are immunosuppressed. Their immunity will be down, so they are more prone to catch up the virus. And as well, if they catch the virus, it's going to be more severe illness compared to other normal individuals. So what precautions they have to take? They have to take adequate control of their sugars. They have to follow strict diet regime, and they have to check their blood sugars regularly, and they should continue their medications under the guidance of diabetologist, and along with following social distance, sanitization, masking, everything.
Okay,
So,
thank you, doctor.
yeah.
Thank you. Yeah, then next question from Mr. Prakash to Dr. Ayyappan. Is it safe to travel in trains, flights, and other public transport when all of them are resumed? What extra precautions need to be taken?
See, traveling in a public transport, I would suggest is if it is not overcrowded, yeah, it should be safe. If you are able to maintain a social distancing, if you are able to have that space marked for the particular, how to avoid overcrowding, then that should not be a problem. But if you think it is going to be overcrowded in a bus or a train or something like that, which is not avoidable in India because of the overpopulation and everything, definitely as we open people, even now, if you see most of the buses, only limited buses are being operated, but most of the buses are overcrowded and people are not able to maintain the social distancing. So at this point, till we have a more number of buses on the road or trains or something like that, that is when it will be safe to travel by public transport.
Okay. Okay. I think there's a set of questions from Praveen. First one is to Dr. Ayyappan. COVID-19 test can be taken at private labs, or if we have to take a test from government agency, whom should we need to contact?
Yeah, most of the private hospitals now around like Ramachandra, Mayat and everywhere, they are doing COVID testing. And there are some certain labs, as I said earlier, they are doing at home also. But government hospitals are also doing COVID testing nowadays. So if you are able to go to any primary health center, and government has given certain hotline numbers, if you are able to contact them, and if they suspect that you are COVID positive, they will definitely ask you, or the health officials will directly come and contact you and take samples.
Okay. So next question from again Praveen to Dr. Vaishnavi. In case if we have cough or fever, by when do we have to contact a doctor, or what should we do? Very general question.
Okay. See, if you have a fever for more than 3 days, definitely contact the nearest hospital or your COVID helpline number, which is connected to the district public health. And one more option would be you have your fever clinic set up in all the private hospitals and in all the government health centers. Even primary healthcare centers have fever clinics. So we can go into the fever clinic and they will examine us. If it's essential, definitely. If you are suspected having features of COVID, definitely they will give you a prescription or a lab request for testing for COVID, through which you can get yourself tested.
Okay. The next question also from Praveen to you, Dr. Vaishnavi. If one is tested positive, not everybody can afford a private hospital treatment. How to get the treatment from government hospital?
Actually, what the norms right now, government is having is if you are going to get tested in a private hospital or in a government hospital, you'll have to produce your Aadhaar card. Through the Aadhaar card, if your result is positive, even before you could know the result, the government will know that it's positive. And the health officials are right now coming to respective homes and taking the patients along with them to the respective quarantine centers where they are helped with medical personnel to assist them for their treatment. So nothing needs to be done. If you're tested positive, the government itself takes care of everything. If you are planning for a treatment in a private center, you should probably tell the government official who's coming to you that you're going to get admitted in so and so hospital, and you should approach that hospital for admission.
And one more thing, the entire actually, if one person is positive, the rest of the household members are also quarantined in their house itself, and they are being monitored closely. If they develop any symptoms, immediately they are also shifted to a quarantine center.
Okay. Okay. Thank you. Thank you so much. Next question from Mr. Adiraman to Dr. Deepak. Do we have to sanitize our footwear after coming back home?
Yeah, it's a good question. Till we are treating our footwear as footwear, we don't have to sanitize. That means if you are leaving your footwear outside your home, and you are not smelling your shoe, you are not keeping it on the kitchen top, you don't have to sanitize. So, but sanitization of shoes are recommended for healthcare workers who are treating with the COVID patient, either confirmed or suspected cases, because they have found that a good number of virus has been detected on the soles of the shoes. So there is no harm in sanitizing, but it is not required for general public. But it is definitely required for healthcare workers.
Okay. Next question, interesting one, or normally what we see in a lot of WhatsApp and other forwards, asked by Mr. Sriram Balu to Dr. Vaishnavi. Is drinking hot water with lemon squeezed in it helpful in preventing coronavirus attack as advised by a few people? Now, this question, Dr. Vaishnavi, is not only regarding lemon and hot water. It is about so many other things that keep coming, where they ask you to take, so many, green herbs and other things, and then mix it and use it. So you can also give a generalized.
Basically, whatever precautions that they have been telling, or even the Kavasura Kudineer or whatever they have been telling, no, it's all supposed to boost your immunity. If you drink this, it definitely, if you have a patient close by and if you drink this, you're not going to get, there's never such a scenario. The virus will definitely come and harbor in our body system. But what will happen is that when the virus is trying to multiply or so, your body immunity will help. Since it's boosted up by these, it will help in fighting the virus and decrease its multiplication. That's what is going to happen through all these, Ayurvedic or homeopathic medications that they have telling. Even people say you consume camphor, you consume this leaf, that leaf, everything, whatever they believe is for immunity and nothing more to it. None of it is approved to have any antiviral property against corona, actually.
Okay. I think very, very neatly put. Thank you. The next question again from Sriram Balu to you, Dr. Vaishnavi. Apart from spreading from human sneeze droplets, is there a possibility of virus spreading from asymptomatic person while he is breathing near another person?
Definitely it can spread through other modes of transport. Say if you're speaking when there is a spit of saliva or through a nasal secretion, even tear secretions, all this are supposed to harbor the virus. Even stools and urine samples have proved to have shedding viral sheds are supposed to be found. So if a person is asymptomatic and is having the coronavirus, he can spread it through all other means: coughing, sneezing, handshaking, or even tear secretion. Everything can spread the infection. So better.
But the fact that when you sneeze, the radius would be more where it can spread, whereas when breathing, it could be the radius could be much smaller, right?
Yeah, definitely. The radius is smaller, but if it's going to be in a close contact, yes, you're prone, right?
Yeah. Correct. You're right.
One second. Breathing, the chances are less, but with the speaking and coughing, sneezing, the chances are high.
Okay. Thank you.
It is going to be in the aerosol for a longer time. So that is what everyone is trying to say.
They are all aerosol generating procedures.
Okay. Thank you. Next question is from Sudha Sairam to Dr. Ayyappan. Whether we can have cold items straight from fridge or freezer, because everyone says to have hot water also.
The thing is, now everyone is worried because we will not be able to differentiate between a common cold, as you said earlier, differentiate between a common cold and that of a coronavirus or something like that. If you are prone to develop a common cold or anything, having something from the fridge, better avoid it. And the next thing is, if you think about taking a hot water or something like that, that soothes throat or something like that, that is always advisable. But as such, it is not proven that if you eat cold items, you will definitely develop coronavirus or something like that.
Okay. Good. Next question from Ms. Abarna to Dr. Ayyappan. Is it safe to give clothes for ironing, as the iron shop may have loads of other clothes too?
As far as the person who is ironing doesn't have corona, that is good. But if he is an asymptomatic carrier, which we will not know, it is always advisable after they bring from ironing, keep it aside for at least 1 or 2 days. And then you can start using it, because the duration in which the virus can stay in any clothes is going to be within 24 hours. So after that, always you can start using the clothes.
Okay. Next question from Rashmi Giri and Sudha Sairam to Dr. Vaishnavi. Can anyone take the medicine Zincovit and vitamin C to increase the immune? If so, for how long should we take? Should young people too take zinc and vitamin C supplements?
Okay, vitamin C and zinc can be consumed, but it has to be within your recommended dietary allowance. If it's anything more, is poisonous. So if we are following the standard guidelines, and make sure you see for vitamins, vitamin C, the regular dosage is going to be say 65 to 90 milligrams per day. If it's going to be more in your consumption, then it has to be reduced, because we will try to take another supplement, say lemon and amla, and along with this tablet, and increase the dose, then it's going to be toxic. Similar, I think 8 milligrams, which is advised. So if it's going to go more than that, it's definitely not good.
Okay, so all supplements and natural consumption should be restricted to a given dosage, right?
Yes, definitely.
If you're going to be a healthcare worker, yeah, they need more immunity, so we can think about adding these things with the limits. But if you're going to be a regular, always natural foods like lemon or something like that, which has more amount of citric acid, and vitamin C is always better.
Okay. Okay. The next question from Mr. Prakash to Dr. Deepak. Is it safe to go to salons or beauty parlors now? What precautions should be taken, and what precautions we should insist on with the salon beauty parlor person? Can we have our regular head massages in salon like before?
Nothing is safe. It comes with a risk, but we have to take the adequate precautions. If we take adequate precaution, it will be safe. So the precautions, the guidelines given by the government to follow in saloons are quite exhaustive. But to name a few, every customer at the entry of the saloon has to be screened, thermal screening. They have to be sanitized. They should wear mask and then enter the saloon. The saloon should be without AC, should be well ventilated, should have adequate lighting. There should not be crowding. There should be adequate space for waiting. Ideally, there should not be waiting. They should go with an appointment, prior appointment. There should not be any waiting customers outside. And then some of the therapies like massage care and then pedicure, manicure, shaving has to be avoided. They should go for haircut is okay, but shaving is not okay. They are now they have to disinfect all their devices. They have to and also they have to provide disposable gowns to every customer. And the transaction has to be cashless, that is contactless transaction. And from there, you have to rush in and have your bath, wash your clothes. That's all that.
Okay. Okay. I think, yeah, basically, I think everything is related to this social distancing, wearing mask, hand sanitizing, having bath, all preventive measures.
And
the haircut also has to be quicker.
Yeah, the saloon should also screen their employees, see to that they don't have any cold or anything. Before each day, they should screen their employees whether they have fever or anything. If any employees have fever or anything, they should not be allowed near the customers. Even if they have cough sneezing, it's better if they isolate those workers.
Okay. Thank you. Thank you for your inputs, Dr. Deepak and Dr. Ayyappan. Next question, Mr. Prakash to Dr. Ayyappan. Is it true that people who have any history or ailment in any of their organs, or people with history of sugar and high blood pressure, have a high probability of getting affected by COVID-19?
As I said earlier, See, any patient who has a comorbidities like diabetes or anything, their immune system is going to go down. That is the ability to fight the virus. So any patient with the diabetes or anything, they indefinitely their immunity is low. So these patients should be extra cautious. And if you're going to see any patient who are senior citizens, definitely, yeah, their immunity is low. And also any patient with chemotherapy, patients who are having malignancy or anything like that, the immune status is going to be low. These patients should be extra cautious.
Okay. Question from Mrs. Rashmi Giri to Dr. Vaishnavi. Due to continuous washing of hands with soap, water, and use of sanitizer, my palm skin has started peeling. Scared if I will get any skin disease. What is the remedy?
Okay. Continuous usage, why do you have to do continuous usage? When you're staying inside the house, no need to actually keep washing our hands if we are not going out or coming in contact with anything that is coming from outside. Second thing is, it's now more prone for ladies because they're doing a lot of dishwashing. It's more of a contact dermatitis because of all the spill and say other dishwashing. So what we are supposed to do is, first thing, if we are coming in contact with these, better to wash our hand and moisturize them. There are a lot of hand moisturizers available. It's better to moisturize them with that and just clean water. Wash your hands with clean water rather than applying sanitizers. It's better to wash in clean water and apply moisturizer. This can always be treated easily. It's not a very tough disease to treat, contact dermatitis. So nothing to worry about it at all.
And one more thing, alcohol always causes dryness to your hand. So sanitizer has more amount of alcohol in it. So regular use of sanitizer inside the house is not warranted. Better to wash your hands with mild.
Okay. Very good. Thank you so much. Question from Mr. Prakash to Dr. Deepak. What is UVC? Is it harmful to use this technology to sterilize? There are machines available in the market to sterilize even milk packet using this machine. Is it safe to buy this?
Okay. UVC is ultraviolet radiation. So UV radiation, there are mainly three types: UVA, UVB, and UVC. Usually, sunlight contains all the three radiations, A, B, and C, but UVC doesn't reach the Earth. It will be absorbed by the ozone. Or mainly UVA and UVB will reach the Earth. That too, mainly UVA. UVC is more harmful and dangerous because they have got a higher penetration power. Their wavelength is smaller, but penetration power is higher. And so they are more harmful. They can cause skin cancer, and it can cause even keratitis. It can harm the eyes. So we have to be careful with these devices. And we are still not sure how effective are these devices. Ultraviolet radiation definitely kills the bacteria and viruses, but the dose that is required to kill the corona is quite higher. And the shielding or the coverage which is required, which is provided on the top of the light, has to be conductor. It has to be UV conductor, which is not easily available in the market. They are actually covering it with the LED conductor. So that will reduce the penetration power of the UV radiation. So how much, to what extent it kills the coronavirus is still not yet known. But at the same time, it can be dangerous, and it needs a specialist training to use these kind of equipments. At this juncture, WHO does not recommend the use of UV radiation. Maybe with further testing and proper standardization of the equipment and further testing of the equipment will give you more further information on this.
Actually, it is like a business. Most of them have started to brand everything as UV and anything. So as Sir said earlier, it causes more amount of skin and eye problems. So we are not sure like how far it is successful in disinfecting at home level. So at home level, it is not advisable.
Okay.
See, UV radiations have been used for disinfecting the aeroplanes, hospitals, and even water. It is useful, but it needs a separate dose for coronavirus, which is quite higher. And UVC radiation is quite dangerous when it is exposed to the human skin or eyes. So we need to have a specialist way of using it.
Okay, thank you so much, doctor. I think we have one more question that we can take. Should we wear mask whenever we step out of the house, or do we need to wear it only in crowded areas? This is a question from Mr. Prakash addressed to Dr. Vaishnavi.
If you're not going to come in contact with anybody and it's a well ventilated open space, it's okay not to wear a mask, like as if going for a walk where nobody is around. But if we are going for some shopping and we are going to have some human contact, it's better to wear it.
Okay, very simple, straight. Okay, great. Thank you. And with that, the listed questions are over. And now I'd like to introduce my dear friend and co-host and moderator, Mr. Anil Giri, who will maybe, in case some YouTube people viewers have asked questions, he will raise it, and he'll also propose a word of thanks. Mr. Giri.
Thank you, Ramesh sir. Welcome to everyone once again on this show for the week. I've got about 8 questions which have come up on YouTube. Of course, none of them are a repetitive of the existing ones. So I'll shortly run through these. Before I start that, Dr. Vaishnavi, the last question which Ramesh sir asked about wearing a mask looked quite simple, but this was in relation of because WHO releasing a guideline today morning's newspaper. I forgot to mention that when the question was framed for today's session. So are you aware of that guideline, something which came out by WHO on the usage of masks?
The masks are supposed to be used only when you're coming in contact, and when it's not required, you have to use it very often. Is that the one you're telling about?
Yeah, specifically to that.
Too much excessive usage. People are wearing it everywhere, inside the house, inside their restrooms, everywhere. That's not required, not necessary, because it's not an air communicable disease as such. Like the aerosol doesn't stay in the air for hours together, for months together. So it's not required.
Yeah, today's WHO recommendation also says that it advocates different kinds of masks for different kind of people. So if the person is in contact with a COVID-19 patient, he has to use a surgical mask or medical mask. Mm-hmm. But if the person is a regular normal person, 3-layered mask is adequate for him. The 3 layers also, they have defined what has to be 3 layers. The inner layer has to be cotton, the outer layer has to be polyester, the inner middle layer has to be polypropylene. So all these guidance they have given, and it has to be used, as Dr. Vaishnavi rightly said, it has to be used in crowded places, and particularly when you cannot avoid social distancing. And you don't need to wear when you are alone. And if you are a senior citizen and your immunity is low, if you are a post-kidney transplant, or if you are on chemotherapy, better to wear a surgical mask rather than fabric mask. That is a recent guideline. That is today's guideline.
And N95 mask only for healthcare workers who are going to be in contact with that of COVID patients. So we see nowadays many people wearing N95 mask even when they're going for market or something like that.
True.
Which is not at all needed, or which is not warranted. It's not advisable also.
And many are wearing mask with the respirators, which is again not advocated. The mask with the respirators, where you can see when they are breathing in and out, there'll be flip-flopping of the ball. So that is actually that is not advocated, because when the person is expiring, it won't filter his expired breath. So the others can be at risk if the person is infected. The persons who are coming in contact with him are at risk. The person may be safe, but his contacts will be under risk.
Thank you, doctor. That gives a lot of clarification on the simple usage of masks. Okay, let me shoot the questions which I've got on YouTube from the viewers. I have Ms. Anuradha from Mumbai, who says, since lockdown is relaxed, there will be spike in community transmission. COVID being asymptomatic, if we come in contact with COVID-19 carriers in shops or commonplace, person using masks but social distancing not maintained, is there still a chance of getting infection?
Yeah, definitely they get infected. As I said earlier, asymptomatic carriers is one category which we will not be able to identify also. So maintaining a social distancing, wearing mask alone is not a criteria. Maintaining social distancing is a must, which is now being followed in many places. That is what government is insisting again and again. Please maintain social distancing. If you think that place is not having social distancing, it's better to avoid going to those places.
Yeah, because recent photographs in the media also, if you see, there are people wearing the mask properly, but they're not maintaining social distancing in markets or shop areas. So that's the concern raised over here.
See, we are wearing a mask, but other parts of our body are still like,
Yes.
there is no social distancing. A patient coughs or something like that, it's going to be on your body surface somewhere. And by mistake, you are going to touch anywhere, and then you are going to touch your face or something like that. Again, you're going to develop an infection. So, better avoid a crowded place. And if you are able to maintain social distancing, it is safe to go to that place.
One more thing is that mask never provides 100% safety. Definitely a
True.
5% chance are there that the aerosol could, even with N95, there are 5% chance that the aerosol could contain the droplets. So definitely social distancing is the main norm which is supposed to be followed.
One of the most neglected aspect is we should not touch our eyes, nose, and ears and face. This has to be thrusted upon the people. They have to understand it. They may touch things which may be contaminated, and they may touch their eyes, nose. It is the usual mode of contacting the disease, so which has to be avoided.
The main culprit now is our telephones, our mobile phones, which we use.
Right.
We
Yeah.
tend to touch somewhere, we touch our phones, we keep it near our ears and something like that. So that is why maintaining a social distancing is always advisable.
Thank you, Dr. I'll now move on to my next viewer. Mr. Tyagarajan has raised a question that our latest Tamil Weekly published an article by a doctor. He recommends hydroxychloroquine as a preventive measure by all, including people with other illnesses. The dosage was also given in the article. What is your opinions about it, Dr. Deepak?
Currently, it has been recommended only for the healthcare workers who are frontline fighting fighting COVID-19 or either confirmed or suspected patients.
Okay.
And also for those doctors who are immunocompromised and those who are treating the general public.
Because it causes heart changes in their ECGs and other things. That is also one thing that should be very careful.
Yeah, it can cause sudden death, particularly if your QT is prolonged in the ECG, and if you are having other heart ailments. You can have eye changes. You can have bone marrow suppression. It can be hepatotoxic. That it can cause toxicity to the liver. It has to be consumed under medical supervision only, so not for general public. It is not an on-the-counter drug, so it has to be taken with precaution and safety.
And there are just studies going on that HCQ is not a permanent, it's not a treatment for it's just a preventive measure that they are doing. Studies are only in trial phases also. So it is to be with a caution.
All right. Thank you, doctor. Okay, my next question is from a viewer, Mr. Suresh Iyer, to Dr. Deepak. I see many people wearing masks inside a car. In fact, government too insists. The police also, if you notice today, nowadays, the police also stops you if you're not wearing the mask. Will it affect oxygen flow inside?
First of all, it is not necessary to wear a mask inside the car, provided if you have closed all the windows and if you're alone and if you're using the AC with a good air circulation, you don't need to wear the mask inside the car.
True, doctor, but if you look at it, even I've experienced this personally, unless the mask, even if I'm not covering the nose, if it is visible here to the policeman on the road, he doesn't stop me. But if it is not visible, they stop us. So the education level at that place also has to be there.
Yes, yes. Police also need to be educated in that regard. If you are wearing mask all the time, you are definitely the oxygen levels in your body is going to be low, and you are going to suffer with that. We are built to breathe 21% oxygen and exhale 16%. If you are wearing the mask all the time, you'll be breathing in only 16% of the oxygen. So your cells will suffer with less amount of oxygen the more time you wear a mask. So wherever you can, you avoid mask. Like when you are in a secluded place, when you are alone, when you are in a garden alone with a good social distance, when you are at home, avoid it.
All right, thank you. Dr. Ayyappan, they say vaccines are in phase 3 of implementation. How far this all-purpose vaccine is effective, and can you throw some light on it? This is asked by Mr. Arjun Rao.
Yeah, the thing is actually now vaccines are in trial phases. Even as Sir said earlier, AstraZeneca is now working on it. But the thing is, the outcomes of the vaccine, the side effects and everything will be known only after a certain time. And mass production of this vaccine is going to take a very long time. So until we get a vaccine to everyone, we are all prone for developing this infection. So there is some time. as I almost by another 1 year or something like that, we will be able to have the vaccine for all of us.
Thank you, Doctor.
AstraZeneca has started producing the vaccine without complete clinical trials. They are taking risk. They are
So-
taking risk. They are planning to produce 2 billion doses by September. If they become successful in their trials, definitely by September you are going to have the vaccine.
And getting everyone vaccinated is going to take a long time. And
Yeah,
also,
yeah,
for
definitely.
this vaccine also,
Initially, it's going to be only for the high risk category. Then later on for general public.
Okay. Thank you, Doctor. Dr. Vaishnavi, Ms. Meera Suresh wants to know, by when is the curve expected to flatten in Chennai?
This might take a longer time, probably with a better social distancing, and we don't know, probably another 2-3 months also it might take, actually, from what we are thinking, with the regulations in line.
Okay. Okay. The next question is also from her to you. Is it safe to have salads now? And also, can coriander leaves and curry leaves be used raw?
Actually, for taking salads, it's better if you have, wash those vegetables and fruits really properly and peel the skin off. If you are peeling the skin off and using those fruits and vegetables, then it seems like a little okay to use them. And as far as coriander and other things are concerned, it's better to wash them nicely in flowing tap water and leave it aside for 2 or 3 hours and then use it raw. Then it's okay.
Okay. Thank you, Doctor. Dr. Deepak, Arjun Rao would like to know, the earlier symptoms of COVID were mentioned, people lose sense of smell. What are the early symptoms what other early symptoms do you see?
Okay. Other symptoms can be fever, sore throat, breathing difficulty, or some people can have altered sensorium also.
diarrhea also in some patients as well.
Okay. Great. I had this list of questions which I pulled out from YouTube, which is done. I'm just getting 1 or 2 more questions coming in. If you just give me a minute.
One more second here, what I would like to add is, if you can cook and eat, that is the best way. Wherever possible, cook and eat. Don't persist on having raw as far as possible.
Yeah. Thing is, for paper, for metal surfaces, they identified how long the virus is going to stay. But on each food items, they have not yet known. So it is always, as I said, it's better to cook and eat.
Okay. Okay. I have a viewer, Mr. Saravanan R, questioning Dr. Vaishnavi. Hello, doctor. We are in Pural. Can you suggest what precautions we take for COVID? Okay. He's not been very specific about anything, but he's just asked about general precautions.
Okay, it's basically general precautions what he is supposed to be following inside the house. If they have a COVID patient inside their house, it's better that they social distance in each. If they have children's, they shouldn't be going inside the house of the other person or the room of the person who's actually infected. And second thing would be avoid sharing the vessels with the person who's infected. They should have a separate vessel. And one more thing would be they should avoid. They should have a particular caretaker for the people who's actually taking care of the COVID patient. Other people should definitely avoid coming in contact with the COVID patient. And maybe about clothes, the person who's infected is supposed to probably put it in some Dettol and give it. And the person who's actually washing it is better if they wear some gloves and mask and clean it with that. And they can sanitize their hand after using it, after doing it.
Thank you, doctor. I have one more question from the viewers. Mr. Tae Jung, he says, if I am a COVID survivor, it means my plasma can fight the virus. He's asking this.
Yeah, yes, definitely. If you are COVID survivor, we have to check your antibody levels. If you are a survivor, we have to check your antibody levels. If your antibody titers are high enough, we can use it for providing plasma therapy to others.
Okay, thank you.
Before Mr. Anil, before you go for the thanks and all that,
No, I have one more
particular
question.
thought that I came to my mind.
Yeah.
Now, the doctors, experts here, I want your opinion purely on the medical front, because the government takes medical, economic, and so many other aspects into account. Do you suggest that suppose we go in for a full lockdown again for 1 week, is it going to help in Chennai to reduce the rising numbers?
Yeah, if you're going to not worry about the economy and thinking about only the healthcare system as of now, definitely yes, this lockdown is going to help because now, as I said earlier, asymptomatic carriers are roaming around. So these patients can be like a carrier spreading the infection. So if they are going to be staying at home, so the duration, this virus spread can be avoided and it can be contained.
Another 3 week would be an ideal period for them to actually know that they are symptomatic and get themselves treated and come out of the disease. Another 3 proper lockdown, no shops, nothing, like the first 3 weeks. If it's going to be that, then it will be of use. If it's going to be relaxed, then there is no point.
Okay. Thank you, Doctor.
I have my next question from Mrs. Sundari. She would like to know, one is, what is the difference between pandemic and epidemic?
Pandemic is worldwide. Epidemic is nationwide. That's the difference.
Thank you. And her second question, I think we've already answered this in today's session. Type of mask suggested, single layer or 2 layer or 3 layer?
Currently 3 layer. 3 layer.
Currently 3 layer, yeah. This has been answered. Prakash sir has also just pinged me to ask Dr. Deepak about the UVC device, what we spoke about. He has a particular doubt that UVC device is used in some hotels now for sterilizing vegetables. Can you confirm with Dr. Deepak? Also for COVID, they have the DNA cracks at 235 nanometers and UVC has 280 nanometers. Sorry, I don't know if you're able to understand that.
Can you come back on the question again?
UVC device is used in some of the hotels for sterilizing vegetable. That's one part of the question. Can we take that first?
Okay, right.
And, yeah, go on now.
See, it is mainly being used in aeroplanes and some of the hospitals. In the hotels, it is rare. It's not a common entity.
Okay.
Although some people may be using it. Maybe large hotels may be using it. I'm not sure of it.
Okay. And he also joined the question stating COVID, they have the DNA cracks at 235 nanometers and UVC has 280 nanometers. Any idea on that? Have we lost Dr. Deepak? His video is frozen. Uday?
Ask him to rejoin.
Uday, are you there?
Yeah, I'm there. I'll ask him to join back.
Yeah. Okay, by the time we wait for Dr. Deepak, there's one more question which has popped out. Are smokers at more risk? This comes from Ms. Jayanti Ramesh.
Definitely they are at increased risk because their lung capacity and capabilities are definitely on the lower side. So if they get infected, their probability that they would get out of the disease will be much lesser than the common crowd.
And also, usually COVID, they causes lung changes. There is fibrosis and other things that happens with this COVID virus. In a patient with a lung smoker, the lung capacity, the amount of air they breathe and other things, the lung damage is already there. So they have a very high risk. So I think it is the right time for them to get smoking.
All right, thank you. Dr. Deepak, are you back?
Connecting. Now I have switched on the split screen as well, but the grid also is on.
Okay, by the time you come online, I have my last question to Dr. Ayyappan. Many people are frustrated and stressed and developing anger during the lockdown period. Is there some advice for them?
Being in an isolated place for such a long time, definitely, yeah, everyone is getting a little unrest over this period. The thing is, we have to use it as a positive thing to think that it is for our best. So whatever we are doing now, whatever we are staying at home, it is for our safety and for our family members. So they can indulge themselves in doing some physical activities like exercises at their home. They can take care of yoga or something like that, meditations, and they can have some positive vibes around them than thinking about seeing all the negative things in the TVs about news, what is happening around and everything. Anyone starts to panic, what is this? We are losing everything. So watching too much of information, as we said initially itself, getting too much of information from the around us is also harming us nowadays. So we have to stay positive only, and hope we are going to come out of this in very soon.
Positive way. Thank you, Doctor. So before I close the YouTube question, I have one last popped up question. So I'll take this last and then close it. Mr. Suresh Iyer says, pharmacies giving masks in news by counting those masks with their bare hands. Is it not risky? If so, what is the other alternative?
There are masks which are provided with covers. Single properly packed masks are available. That would be better. If you feel that hygiene is a problem, don't use those masks immediately. Once you come home, allow them to air dry for the next couple of days or 3 days, and then you can use it.
Dr. Vaishnavi, yeah, I've also noticed this, what Suresh is asking. Even if you go to the nearest Apollo, they've got the bulk of the mask inside one single cover. And while you say that if you feel that it is hygienic, don't we think that they should feel it more hygienic to give the mask in a proper way? So is there any alternative?
Actually, the thing is, before this COVID was, I think came along, this individual packing of masks were available. But now they're doing it in mass production. So what they don't have time for this individual packing or anything. So they are sending it as a bulk. So it is up to the shopkeepers to see to that. And even if they are picking up it and giving, if they hold the strand and give it, it is okay. Some shopkeepers, if you see, even in grocery shops nowadays, masks are available. They are not aware from which surface to use. They usually touch the surface where they are not supposed to touch. They're going to just touch the strand and give it to you, and it is not going to be. Even in our hospitals also, we have these masks coming in bulk only. So when they are handing over to us, they'll just start touching the strand which you are going to tie in the back and give it to us, not the center surface or anything which we are going to keep it over our face.
You can always insist them to wear a glove or use a sanitizer before they would count.
That is also
a customer.
Thank you. Thank you, Doctor. So I'm done with my questions. I'll just read out a comment by one of our viewers, Mr. Raman AK. The points made were very, very useful. Guidance provided was very clear, simple and straight. Thanks to the experts and the hosts. Questions were great too. Thanks all. So this is by Mr. Raman. And with this, I would like to, on behalf of the entire team, we would like to sincerely thank all our doctors. Dr. Raghavan could not make it for this week, but he was present with us in the last week, and who, despite their busy schedules, took out time and volunteered to answer the concerns and queries of our residents. The situation in today's time is like that. The concerns, even there would be some questions which have already been answered, but still these are being repeated because of the people's concern. It has been two good sessions, which has helped us a lot. And I'm sure that most of us have benefited from this session by understanding the situation and resting our fears to a great extent. I would personally like to thank Mr. Ramesh, who came forward and volunteered to moderate these sessions and did a commendable justice to his part. I sincerely thank Mr. Prakash Krishnagiri for this concept and the whole team behind this entire program for the last two episodes, starting from my marketing team, the doctors empanelment team, the question coordination team, and the entire team of online casting of YouTube and the technical YouTube team. But last but not the least, I would also personally like to thank the FOFA and their entire team for their support, coordination, and cooperation to make this program a success. And I'm sure the entire residents, the viewers, their families who have been seeing this program and will continue to see this as this will be telecasted on YouTube for a long time, will get benefit out of this. Once again, thank you all for your time. I'm very happy we winded up the session in 1 hour because the concern in the last session was it got extended a little, but we managed to close it at 1 hour today. Thank you so much.
Yeah, thank you all. Thank you all so much. Thanks for the expert advice.
It's a great pleasure. Thank you.
Thank you, sir.
Thank you, doctors. Thank you, Dr. Deepak.
So we'll call it an evening, okay?
Thank you. Uday, over to you.
Yeah, thank you everyone. Thank you.